So we're going to demonstrate PNF stretch. And I'm going to have to look up the true name. I know it's proprio neuromuscular function. So this is pretty much as far, I'm going to hold this leg down. This is pretty much as far as your hamstring will go.
Okay.
So that's the hamstring right here. I'm trying to stretch this muscle. It won't go any further.
Okay.
So, and go from the side for me real quick, Dr. Matt. Can you? No, you're okay. So if you look, I'm trying to find a landmark. We're here. So her hand, this is where her hand is right here. That's pretty much as far as her leg could go, right?
Right.
That's it. So it's kind of almost at 90. So I'm going to have her resist against me. So push, keep pushing as hard as you can. Keep pushing, keep pushing, keep pushing, keep pushing, keep pushing, keep pushing, and relax.
And now you're going.
I'm past her toe. It's past the hand now.
That's right.
So that just pretty much PNF, it tricks the muscle. I fatigue the muscle as she's pushing against me, and it tricks the muscle to relax, and then I can go deeper into the stretch.
Okay.
So it immediately increases range of motion.
Okay. So now if we want range of motion, or if we want motion to be correct
in the mouth.
In the mouth.
So the masters are the muscles that close the mouth, right?
Right.
So I would have her open. And I want to relax these muscles. I want to increase the range of motion of the master. And I'm going to resist her closing. So close. Close, 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 close. And relax. And open for me. If she were to have a problem opening, these muscles are so tight. They won't allow her because they're so tight. They're going to keep tight. These, if I did PNF a couple of times, if not once, it will allow her to go, oh, okay. It will be increased range of motion. Right. Immediately. Okay. PNF will do it immediately.
Okay. Got you.
All right.
Now, but go ahead to your master palpation.
Master palpation, basic massage, bringing blood flow to it. You can do both sides at once. I'm going to just do one side at a time. So we're here. Then I do circular motions throughout that thing there.
Now they have different names, these movements?
If I'm just a regular stroke, that's just basic effleurage, and circular motion, circular motion. If I'm going across the muscle lays this way. If I go across, of course, that's cross friction, because I'm going across the muscle,
okay,
which is used for when you want to break up adhesions or scar tissue. And then if you want to do active release, you go in here, and you have to, the more you do it, the more your hands will get, used to finding spots.
The spot being a trigger point.
Right. Or a not happy muscle or inflamed muscle, or I could say if your body is a parking lot, I'm driving and I feel a speed bump, there's something going on right here. So I will press here and I'd have her open and close. I'm only applying pressure as she opens.
Which is?
Active release. I'm doing active release on her. Right. So open, close, right there. Open, close.
Okay, but now the master closes the muscle, so active release is when...
So this muscle is... Do I have a rubber band? I should have had a rubber band. Let's use this here. So, let's say the master runs from here to here, right?
Right.
That's the master. Okay. So, I'm pinning a point, right? So, and I'm having her open, so she's only stretching that area of it. Then I find another point, and I'm having her, and I'm stretching different areas of that muscle to elongate the muscle as a whole.
And that's what you call pinning.
Right. I pin by pressing, and then I have her open to lengthen. Pin, open, lengthen.
Okay, gotcha.
And that's pretty much what I do on masters. Same thing as the hamstring. It's no different. The master is the same thing. I pin different areas of that muscle.
Show the different stretching you showed a while ago, where you up underneath there, but there was another one that you did
for pressing down into the jaw, or actually tractioning.
Any of the actions that you would
do. Okay, so I did resisting me when she was closing, right? So I would hold here and open. I would have her resist me while she's opening. Okay. I know a lot of people go in here and relax, and even in the temporalis, I don't do often. But I was taught how to actually just, you put your pisiform, that's the name of that muscle right there, right into the temporalis. You see I'm here?
Yeah.
And you open for me. And you can get in the temporalis.
Oh my lordy.
That's one way to get in the temporalis. And it saves the thumbs as opposed to, but that's serious. Let's see, another one for the mouth. You probably could use your pisiform even on the masters here. And just go in that motion. I like the thumbs better because I like the feel. That's just me being crazy. But those are really the main things that you can do for here. And those really get into the masters.
Well, the thing is that people are used to like massaging the back and really working on trigger points to be painful. Nobody's used to this in the mouth.
Trigger points in the mouth.
Yeah, nobody be used to this. So that's
any muscle that the body has can become overworked. Any muscle, any muscle, any muscle, it's becoming overworked. Unless you just don't chew forever. If you don't chew, if you don't talk, if you're mute, you don't talk, you don't do anything. Any muscle you use is going to be overworked. If you're using the muscle, it's going to be overworked. I don't care if it's from the foot to the mouth to the head to the ear.
But in running, the better your form, the less you're going to destroy.
Right.
And so if you have an orthotic, the better your bite,
right,
then the less you're going to overwork.
That orthotic is pretty much saying, hey, all my tires are balanced, and I'm going to ride smoothly.